All right, turning now to a shot of hope. It's what it's being called by so many. Vaccine distributions continuing to roll out right here in our very own state.
Indeed. So today, a number of first responders slated to get their first dose of the vaccine. Fox 61's Lauren Zinzi joining us from Madison this morning. There started to be a little bit of buzz where you were, Lauren, earlier. What are things looking like now? All right.
Looks like we don't have her. We'll check in. But yeah, she was inside the gymnasium out there in Madison, and we could see some of the first responders who were getting the beds set up, and the EMTs were going to be there. So we'll check in with her again because we definitely want to see how many folks actually end up going out there today.
Yeah, they seemed very, very well organized. But we do want you to know that really throughout this entire pandemic, we are trying to sort through kind of the confusion with you. You ask, we answer. Checking in once again this morning with UConn's Dr. David Banach.
All right, David, good morning. Thank you for joining us.
Thanks for having me on.
So you just heard us say we have one of our reporters in Madison this morning where some folks are getting vaccinated. And so we've got a lot of questions coming in. Folks having so many different questions about the vaccine, as I'm sure you are as well. What do you think is the number one question you receive, or the number one thing that you think is most important for people to know as this vaccination rollout begins?
So, and I think the biggest question that we're getting now is basically, how are things going? So we've started vaccinating our healthcare workers, our frontline healthcare workers here at UConn. A lot of vaccine rollout in the community, and people want to know, how are people doing? People having any side effects? And I think we're really pleased with how things are going here at UConn. We vaccinated now over 2,000 of our frontline healthcare workers, and the vaccine's been very well received. In terms of side effects, very minimal. We haven't seen serious side effects occur, and I think everyone's been very pleased with how things are rolling out. So a lot of enthusiasm here on the front lines, and we're planning on moving forward with vaccinating the rest of our healthcare workers throughout the next month.
Dr. Banach, right now this is what people are talking about. I was on the phone with a dad of 3 yesterday. It was consuming his Christmas Zoom calls, and there was a bit of a debate in his family. He was ready to get the vaccine for his kids. He and his wife were all on board for that. Not everyone in his family agreed. I wonder if you'd speak to those families at home watching this morning who may still be on the fence as to whether or not the vaccine is right for them, and perhaps more importantly, their kids.
So, I think when we look at the big picture, we know that COVID-19's had such a tremendous impact on all of our lives. Here in Connecticut, unfortunately, a lot of folks who've been hospitalized, and even a lot of people who have died. And so we know the impact of the virus. In terms of the vaccine, the vaccine has moved very quickly, and I think some people have maybe some caution with that. I think the most important piece is that when we look at the phase 3 clinical trial part of the evaluation of the vaccine, and that's really what led to the FDA authorization. It was done incredibly well. The number of individuals that were included, well over 30,000 in each the Moderna and the Pfizer vaccine. Very robust data showing that the vaccine is really effective in preventing illness. So I think we have to take that information into account. That coupled with the infrequency of adverse events, side effects, I think really bolsters the confidence in the vaccine. So we know this is going to be critical in sort of our next steps in getting through the pandemic. And I think that needs to be the forefronts of our mind when we're thinking about whether or not to take the vaccine.
Something else that's kind of been at the forefront of especially news headlines, reports from Britain and South Africa of a new coronavirus strain that seems to be able to spread a little bit more easily. It's causing a little bit of alarm. Are there any new coronavirus strains that we should be concerned with here? Is there anything that you're aware of, or is this maybe just something we're seeing in other parts of the world?
I think it is important to take note of this. It isn't surprising that different mutations and different strains are occurring. That happens with coronaviruses. We know that from past experience. So with this one, I think it's something we have to be attentive to. Fortunately, the changes that we're seeing occur in the strains that have been identified in England, South Africa, wouldn't necessarily, based on what we're understanding, render the vaccine to be any less effective. And that's really important for people to know. But on the other hand, we do need to keep a close eye on it. Some things like, understanding whether this particular strain may be more infectious is something that we're really attentive to, and, how it might impact things like using some of our therapies, like our monoclonal antibodies, that may have an impact as well. But I think, the big message is, it's something that we're learning more about. We have to collect more and more data, and I think we'll have to, see where this goes in the future.
UConn's Dr. David Banach, we so appreciate you regularly joining us here in the morning show. Wishing you and your family a wonderful new year, and please come on back.
Thanks for having me on.